pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We do have two of our commissioners who are joining us this morning virtually. Welcome to a wintry day in Johnson County and the metro area. I do have one comment this morning. A proclamation has been prepared recognizing Black History Month. Our process this morning will be a little bit different than what we've done in the past. The public health order will be the second item on the agenda following the approval of minutes. And at that time, we will have reports from the staff as well as Public Health Department. And then there might be questions by the commission, and then we'll open it up for the public comment. I think most of those who have indicated they wish to speak are interested in the public health order. So we'll hold that public comment period until that time. But first of all, I would like to ask the clerk to please read the notes for the record.
Thank you. The chairman noted for the record that he would sign the following: agreement with the City of Fairway and the City of Roland Park for the public improvement of Bonavista 53rd Street from Shawnee Mission Parkway to Mission Road. Agreement with the City of Mission and City of Roland Park for the public improvement of Johnson Drive from Lamar Avenue to Rowe Avenue, and an agreement with the City of Spring Hill for the public improvement of North Webster Street and 199th Street intersection.
Okay, that concludes the notes for the record. We'll move to the consent agenda item. Would the clerk please read that item?
Item number 1, consider approving the January 27th, 2022 business session minutes.
Are there any corrections or additions? Ms. Allenbrand.
Mr. Chair, I have a motion when you're ready.
Go right ahead.
I move to approve the consent agenda as president.
Myers, second.
Allenbrand made the motion. Myers seconded the motion to approve the minutes as presented. Will the clerk please call the roll?
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Eilert.
Eilert, aye. I have 7 votes in favor. Motion carried. Moving to item number 2.
Sitting as the County Board of Health. Review Board of Health Order number 001-21, elementary schools.
Mr. Connor.
Good morning, Chairman and Commissioners. Joe Connor, Assistant County Manager. The item before you today is a review of Health Order 001-21 that mandates face masks on all students in the 6th grade and below. This was requested to be brought forward from the January 6th meeting of the board, and so this is what the item is prepped for today, is to review that current order. I did want to note one change in the briefing sheet from agenda review from last week. Under the analysis section, it still reads that most of the Johnson County public school districts continue to implement mitigation plans that require masks to be put back in place, but the number has changed from 5 of 6 to 4 of 6. So I just want to make sure that was clear for the record, that this is a change in the briefing sheet from last week to this week. We had one of the school districts make a change that would not bring masks back into the school district if certain thresholds are met. And at this time, we'll turn it over to Dr. Areola for comments on the current state of COVID-19 in our community.
Okay, just to clarify, 4 of the 6 districts do have protocols in place yet?
They have thresholds that are set that would trigger masks to be worn in school buildings, depending on the infection and absenteeism rate.
Okay, thank you. Dr. Areola.
Good morning, Chairman. Good morning, Commissioners. Dr. Areola, the Director for the Department of Health and Environment, providing updates on COVID-19 and making some comments afterwards. With me is the Deputy Director, Charlie Hunt, and our Director of Epidemiology, Elizabeth Horseshoe. Next slide. I'll go through where we are. Currently, our incidence rate is at 306 per 100,000 residents. In the middle of January, when we had the Omicron-induced surge, we peaked at around 2,400 per 100,000 residents. So this has been a big improvement. We also saw the same decline in percent positivity, which is the other metric that we have been using to track the activity of the virus in the community. It is now at 12.2%. That number peaked at over 31% in January. Next slide. In the next slide, you will see the trend for percent positivity. Still higher than where we were before the surge, but it is dropping, and the expectation is these two metrics will drop even further. Next slide. The next slides, I will talk about the vaccination rate, which is another metric that we track. It is important to continue to get more of our residents vaccinated. This slide is data from Kansas Department of Health and Environment, and these are residents that are vaccinated in Kansas. And first row, you will see data on those that are partially vaccinated. We are at about 77%. Partially vaccinated, and at about 67% of our residents that are currently eligible, those that are 5 or older, are fully vaccinated. Next slide. In the next slide, you would see the breakdown by age. Our older population, elderly, who have proven to be more susceptible to the more serious outcomes of COVID-19 are much better vaccinated than the younger group. Next slide. In the next slide, we are zooming in on the 5 to 11, which is our school age group. Slightly over 43% of that age group is now have received at least the first dose, and 33% are now fully vaccinated. Next slide. In the next couple of slides, we would show vaccination rates from the Centers for Disease Control and Prevention. Again, this is showing data that include our residents that are vaccinated in other states. And so the numbers will be higher than the one that we had shown previously from WebIZ. Again, just to focus on our population that are currently eligible, those that are at least 5+, is showing that 95%, which is where this data is capped, have received at least the first dose, and about 79% are fully vaccinated. Next slide. Again, this is the booster information that you can. We have quite a bit more work to do, but I would say that people are coming in to receive their booster shots in our clinics, and the number is going up, albeit not as fast as we would like, but it is increasing on a fairly regular basis. Next slide. That's here we just again say the number of new infections are decreasing. Our vaccination rates are pretty good in Johnson County. Not as good when we look at ourselves as a region. And COVID-19 continue to be more dangerous for the unvaccinated. And the vaccines continue to prove remarkably effective in preventing serious illness. And just to, I know that you are going into discussions. To be clear, is that public health interventions, our role as a local health department doesn't change. We'll continue to work no matter what the policies are to create conditions where every one of our residents can be as healthy as they can. With the understanding that public health interventions typically involve trade-offs, and there's always consideration of competing values, and that every policy options have pros and cons, but our role as the health department does not change. We want people to continue to understand that wearing masks is important, especially for those that are sick, especially for those that are exposed to the virus, especially for those that are vulnerable, elderly, or immunocompromised, that wearing masks continues to be important. We expect updated guidance on mask wearing from the CDC to come very soon. So thank you, Chairman and Commissioners. Happy to take questions that you may have.
Okay. Ms. Allenbrand, did you have a question or comment?
Yes, I do. I would like to make several comments. First of all, I've had ongoing communication with school board members and also superintendents about their wanting to, they feel like they have the metrics in place, just like Mr. Connor had pointed out. They feel like, that they've been successful in implementing those. I also want to point out that I think we, as a commission, have set out with several goals to put into place, was keeping the kids in school and not working remotely, and that is what we've done. I do have a motion, Mr. Chair, when you're ready to rescind the mask order, but I would be remiss if I didn't say a very big thank you to our health director team and all the work that they've done. And I'm not sure everyone realizes how much work went into what they have put together from the time we started in with this virus. So I want to thank Dr. Oriella and his staff. I also want to thank the hospitals because it continues to be a team approach with them meeting on a regular basis, sometimes more than once a week. Also the school board, the elected school board officials, and the superintendents for the tasks that they've been faced with. I just can't say how much I appreciate everything they've done, but I think we still need to listen to what they're saying about, if you're sick, stay home, wear a mask if you're vulnerable, and follow the school guidelines.
Okay. Well, thank you very much. I will recognize that motion following the public comment and further questions by the commissioners. Ms. Hanslick.
Thank you, Mr. Chair, and thank you for those comments, Commissioner Allenbrand. I appreciate that. I did have a couple questions for Dr. Areola. First of all, I did want to make a note. I was just looking at the Johnson County COVID dashboard, and it looks like we've gone down even a little bit more. It looks like the incident rate's gone down a little bit to 298, and the positivity rate's gone down to 11.9. So that's really good news that it's continuing to go down. Be nice to see it go down below 10%. That'd be especially good, which I think we're close to doing. But I had a couple of questions. I agree with Commissioner Allenbrand that originally when we put the health order in place, our primary goal was to allow elementary school kids to have access to a vaccine. And I'm wondering, what is the status of vaccine accessibility for children right now? Is there enough supply in pediatrician's office, in pharmacies, at our health department? I've heard varying reports of accessibility, so I just wondered if Dr. Areola or his staff could speak to that.
Thank you, Commissioner Hanslick. We have been really happy that the vaccines are readily available and broadly available. Even though the uptake is not quite as high as we want yet for those that are eligible, largely the ones that we just started, 5 to 11-year-old, but they're taking it, and the number is growing, increasing. A lot of pediatric offices have them available. Children Mercy and their affiliates have it available. All of our hospital systems have it available. We are running our clinics every week and making this available both during work hours and after work hours. People that come into our locations to get other services are offered the opportunity to get vaccinated. And we're still running community clinics. We have staff that are going out into communities and offering special clinics to vaccinate. So it is readily available. I'm sure that you've also followed the news about vaccine availability for those that are 5 or younger. There's a little bit of delay there because that's another one of our vulnerable groups. But we expect at some point that vaccine will be available for that group, at which time we'll also make efforts to make it broadly available and give opportunities for our residents to be protected.
Okay, thank you.
That, I have a follow-up question on that. I applaud the schools for putting in policies in place, at least 4 of them out of our 6 districts, to automatically return to masking if positivity or absentee rates reach a certain threshold. But I've noticed those metrics vary quite widely from school district to school district. Does the Johnson County Health Department recommend, excuse me, a particular rate or a uniform rate for those schools to consider in making those decisions?
Thank you, Commissioner Anslick, again for the excellent question. We have worked very closely with our schools, our superintendents, our school nurses, from the beginning of the pandemic, prioritizing keeping our schools open and ensuring that students and staff are safe. And we talk to them on a regular basis. I had spoken to the superintendent earlier this week and talked about, again, our job of supporting them hasn't changed. It will not change. We are going to adjust what we do to the policies. And of course, also asking what's going on at the districts where things are. And I think where we landed for now is to keep all options open. The districts have worked with their school board. As we've always stressed, these decisions have to involve stakeholders. You have to consider everything from health to tolerance level and all the other stuff that are involved in decision making. But the school board and us basically at this point decide that if that becomes important or necessary, we will consult together and provide that. But the school boards, the superintendents, based on interactions with their school board and stakeholders, have thresholds. We're making some changes now with consideration of the mask mandate being gone. And so maybe there are changes to the risk level there, but we will see. We'll continue to track the numbers and work with them to ensure that our goals of keeping our schools open does not change. So right now the consensus is let's keep things open. If those become important, we clearly would work with them to do that.
Well, I appreciate it. It sounds like what you're talking about is pivoting a bit to work with individual schools and individual districts to address particular situations rather than with the broad brush of the health order. I did want to ask one more question about vulnerable children and vulnerable school staff. I've heard from many families with immunocompromised children and family members, as well as school staff who are medically vulnerable. They have asked that the health order remain in place through at least the start of spring break when more activities can be held outdoors. But if the health order is lifted today, what plans, either through the health department or through the schools, are in place to help safeguard those vulnerable students?
Thank you, Commissioner. Mandate or not, mask continue to be an important part of the multi-layered approach that we need to do to protect our vulnerable population. And yes, you rightly mentioned the vulnerable population, immunocompromised, the elderly. We have to continue to focus on our group residents that are more vulnerable. The good thing for a lot of our elderly in our senior living facilities is that they are vaccinated, largely boosted. And so while we saw a lot more infections than we wanted, we avoided a lot of the serious illnesses. In our schools, the school environment is going to be very important for the immunocompromised and the and young children, especially those that are not currently eligible, to continue to take those steps. So I've listed, we have worked on steps that we need to take as a community, and that's in addition to us working with our schools to make sure that access to vaccination is easy, making sure that we continue to make access to mask easy so that it doesn't become an equity or whether I have money to purchase that issue. We will continue to do that with our school. Obviously, we want people to wear masks that are as efficient as they possibly can and that they're comfortable with. We'll work with our schools to continue to do that. Collectively as a community, in addition to mask and vaccination, is that we need to continue to work to ensure that rapid tests and other tests are readily available so that when people have symptoms, they can quickly get tested. We are also going to continue to work with our hospitals to ensure that there's availability of preventive drugs now that we have those, and there's also availability of post-infection treatments. So all of those are collectively 5 things are things that we need to do while we continue to monitor the risk and the ability of the mitigation measures to protect our most vulnerable populations.
Okay.
Thank you, Dr. Ariel. I appreciate that. I really am impressed and reassured of how closely you are working with the schools and the school districts and providing them guidance as we navigate through these challenging waters. Excuse me. Thank you.
All right, thank you very much. Doctor, as I recall back in August when we put in place the public health order for the 5 to 11-year-olds, there were three factors that I've commented on several times. One was at that time there was no availability of vaccines for this age group. Those vaccines became available after the 1st of November. So there's been about 90 or 100 days for parents to make the decision about their children to become vaccinated. And if I'm reading the data this morning, you reported 43% of that age group have at least one vaccine, and 33% have 2 vaccines. Is that right?
That is accurate, yes.
Okay, thank you. And then the third factor was community spread, and it has come down substantially, significantly. And I track one of the large hospitals in our county on a daily basis. After the first week in January, their hospitalization numbers were somewhere north of 80, 85. The last 2 or 3 days, their hospitalizations have been at 15 on a daily basis to 16 on a daily basis. And I think the last 2 days, they've had only 1 ICU patient and no patients on ventilators. So all of that is encouraging, and I think adds credibility to the fact that that community spread is coming down and hopefully will continue to drop. So if there is a motion to remove the public health order, I would support that. Commissioner O'Hara, you have a question or comment?
Oh, yes. This is for Joe Connor. Do you have the rates as to what the triggers would be for the school districts?
We did. We have a table put together, and I'm glad to send that to you. We send it out.
I believe Blue Valley is at 10%.
And that was just a recent change between the last board
Yes.
meeting last week and this week. Yes.
Yes, is that correct? And has 10%, has that trigger ever been, has that been ever a reality in Blue Valley School District, the 10% trigger rate?
Go ahead, Salmi.
I was just going to say that the 10% was recently put in place this week. I think I can have Elizabeth go back and look at their data and see if they've ever crossed that line. But when the threshold was lower, it did trigger their having to institute mask mandate for a couple of weeks to prevent infections. Yeah.
Okay, because I understood that threshold was so high that it was highly, highly unlikely that that metric would ever be crossed. Is that correct?
It is a high threshold, but again, the schools, look, there are multiple layers of protection. Vaccination is one of them, and other things that we typically talk about. Wearing masks is one of those, especially those that are more vulnerable. And I'll rather we not try to predict what could happen in the future in terms of spike in infections. I will say though that the school environment continues to be one in which attention has to be paid to those mitigation measures so that 1 or 2 cases does not become 10, 11, 12 cases. So.
And the action by the school districts actually is exemplifying that they have had authority all along to put these these measures in place, and that and according to Judge Mason, her decision just last week, that the school district's home rule gives them the authority to opt out of our public health order. So unfortunately, this has been a long, protracted political dodgeball, where the BOCC was put in the position of having this health order, and the school districts using it as an excuse to put their mask mandates in place. And I'm very glad that this game of dodgeball is over, and that we can now publicly acknowledge that, yes, the school districts do have authority. And that was also talked about with our chief legal counsel before we adopted the health order, and then also exemplified by a conversation with Commissioner Klicka and Chairman Eilert on August the 13th, 2020. So anyway, I'm just glad that we're at this point, and that we can allow parents to make the choice, and the school districts. And so I will be supporting the motion to rescind the public health order.
Okay, thank you. Commissioner Fast.
Yeah, Elizabeth, this week when you spoke to Shawnee Mission School District, you said CDC guidance recommends masking in schools. That's their guidance. That is still correct?
Good morning. Elizabeth Holshoe, Director of Epidemiology. At this time, CDC still stands by masking is an important tool to reduce the transmission of COVID-19 when individuals can't be separated at times when community transmission is still high, which is where we are currently.
Yes. The other, you also talked about, the medically fragile. I've gotten a lot of calls from families, with asthma, children with asthma, immunosuppressed. I mean, what strategies do we do as a health department? And I would willing to make a motion that if we need additional staff to support our schools, to assist, schools right now provide support if a child has a peanut allergy. But, as a person, I have a math, I graduated special ed, early ed, and, the IEPs don't accommodate COVID, the 405s or 504s, I always get it wrong, don't accommodate. What is your recommendation? How are you working with the school districts to help these medically fragile children, which there is a lot right now that will be at risk?
Thank you, Commissioner. First, I wanted to add to Elizabeth's comment on your first question, which is that CDC Director, Dr. Walensky, did speak out yesterday, and we should be expecting updated guidance about masks very soon. But even in the comments from her is the fact that we need to protect the immunocompromised and our most vulnerable population, which consistently you want to make sure that we do. So I would say that continue to work with our school districts. It's very important. I think use of more efficient mask that is protective of the wearer, rather than when we started with cloth mask with the intent attention of protecting others. That shift in wearing more efficient masks to protect the wearer is very important. Now we also recognize that younger children wearing masks may be a challenge in some cases, which again then takes us to the multi-layer approaches of getting vaccinated, getting boosted. But then, okay, then the question of children that are younger than 5 that are not currently eligible. So we will continue to work with our schools as we have done to ensure that we do that. We continue to work with them. The key thing right now in our schools, apart from getting vaccinated and up to date with your vaccine and wearing masks, is an adherence to people that are sick to stay home. Children that are sick to follow proper isolation protocols, and those that are exposed to those that are infected to follow the quarantine protocol. All of those multi-layered approach, as we've said, we talk about the Swiss cheese model, where each of those interventions have holes, but because you have multiple layers, subsequent interventions are plugging those holes for each of those interventions. Multiple layered approach is going to continue to be very important in our schools. Again, changing the approach, changing the policy will change the level of risk. Opening things up will result in a higher level of cases. That will happen. But our goal would be to continue to work with our schools to minimize outbreaks so that 1 or 2 infections does not turn to 10 or 15 infections. So yes, to your concern, we will continue to work with our schools. We think we have enough resources to do that now. Our schools, again, they need to work with them. It's typically initiated by them. They know we're here, we're talking to them on a regular basis, and we'll continue to do that.
I guess I would really support, as somebody who's taught college classes, you have a PhD, you can't evaluate what does support mean. I would like you to present, when you say support, what are the outcomes? Do you have a staff member that works with each of the nurses? Do they provide education? I would like actual outcomes and strategies to assist not only our medical fragile. Each of these schools have early childhood programs. We have littles. There's early special ed, parent as teachers. One school district has 26 early childhood classes. These children have not gotten the vaccines. So all our school districts, some school districts have birth to 4, and so they're in the schools as non-vaccinated and will be at high risk too. So how are we going to mitigate that risk for our early child special ed program? So is that a possibility? Can you come forth and really, for me, as I go speak to all my cities, I speak to my churches, I am out there. And, I want to be able to articulate what you are doing to these families that call to these organizations. How are we mitigating that risk, especially for these families who are very anxious right now? This is a hard time when your child could end up in the hospital, could die because you're so medically fragile. So I think that would be very beneficial for the community too, to understand what support means. And we're getting ARPA funds. What resources do you need? So that is my comment.
Thank you, Commissioner. We will do that. We'll put a presentation together. I can tell you that we have staff working with each of the school districts, but an excellent suggestion from you. We'll put that together, and rightly so, parents of these children are concerned, and that's got to be part of the consideration. We'll put something together and make sure that we do the presentation to the BOCC.
Okay, thank you. Commissioner Myers, you have.
Thank you, Chair, but I think I'll wait till after public comments before I make my personal
all right.
comment.
Commissioner Herr, you had another comment or question?
Yes, I do. What's our definition of high risk? Have we had any, what has been the death rate of children and COVID in Johnson County?
Commissioner, the first part of your question, what is high risk? I think we have consistently addressed that. You've talked about death. Thankfully, we haven't had a lot of deaths in cancers in general in that age group. But I will say, as recent as our last update from Children's Mercy Hospital, there are several other outcomes of concern beyond death. they are seeing a larger than usual, higher than usual number of MIS-C in children. That's the multi-system inflammation syndrome. Then they're trying to investigate why they are seeing that more with Omicron than they did with Delta. Nationally and also here, we have seen with Omicron a higher than usual, representing much higher percentage of infection than they do the entire population, infection with children. So again, and that's not even talking about what the long-term consequences are. So children, yes, there's a risk to them, and any suggestion to the contrary is not good for the health of our residents. A higher than normal number of MIS-C from Children's Mercy Hospital, they've said that publicly. It's in the news.
Dr. Areola, statistically, is COVID a higher risk factor than flu for children?
Yes, it is.
And what is that statistically? What is that difference?
I don't know that I understand what okay, can you, when you say statistically, what outcome, what specific statistical outcome do you want? I will be glad to do that for you.
Well, I think that there are risk factors for flu and risk factors for COVID.
Give me an example. Give me one. What endpoint are you referencing? Let's talk about it.
Hospitalization.
Yes. Again, I just addressed that. COVID is not flu.
No, right. Dr. Areola, I am not suggesting that COVID is flu. I am just trying to understand from a risk assessment point of view, what is the risk for children with flu? What is the risk for children with COVID? And obviously, all of us want to keep our children safe, but I've been looking at the statistics in the school district 259 in Wichita, and they have not been requiring masks, and their graphs look identical to ours as far as the high and then the dramatic drop. And I just think that we need to let parents know that, yes, we are doing a lot of work to keep the children safe, but there are this risk management of mask and the negative impacts has been tremendous. And according to the District 259, that now KDHE has allowed schools to suspend identifying susceptible close contacts. And what is our policy on that in the school districts?
Yeah.
Are we requiring any tracking of close contacts now that KDHE has suspended that?
We actually did that before KDHE suspended that, and before those people that you are referencing did. We were the first to do it around here early in the year, more for resources, but more because we moved because of the widespread infection caused by Omicron. That took away our focus from keeping control or controlling spread to one of mitigation. We did that first, and I've said that publicly. Again, by wearing masks, you are not just protecting children from COVID, you are also protecting against flu. When we talk about the risk, COVID is not flu. When I talk about the spike in MIS-C, those are things that we cannot ignore. When we talk about the concern for long COVID, those are things that we cannot ignore. Our role, our responsibility at all times is to create conditions where every one of our residents, especially the most vulnerable, the children, the elderly, the immunocompromised, are kept safe, healthy, as much as we possibly can. So I understand the differences in opinion in terms of risk management options, but lessening the impact, it shouldn't be one of the things that we talk about.
Thank you, Dr. Areola. But what I need to understand is what authority does the Department of Health in Johnson County and the authority of the KDHE, even if we rescind this mask public health order, what authority do you have over the school districts on these issues?
I would, in terms of authority, I would defer that question to PEG or our legal department.
Yeah, I think we're all aware of the recent district court decision that's been made, and there have been previous district court decisions made in regard to this issue, which have changed because of higher courts. So I think we just need to recognize that that is a district court decision of that recent case. So I do want to move to public comment as soon as we can.
Right. Chairman Eiler, I'm not talking about that court decision. I'm wanting to know, I need to understand what authority our Department of Health has over schools and preschools, because I am getting communication from daycare centers that they are receiving communication that seems to have very dire consequences if not followed. So I just need to understand this so that I can communicate with the community.
Well,
And,
if I'm understanding your question correctly, KDHE licenses daycare centers, and they also license long-term care facilities. And so both of those groups have to follow a KDHE direction. And the ability to evaluate their compliance probably rest with our public health department, but that KDHE makes any final decisions in that regard. So that's the process. And so whether you're talking about the daycares for the very young or the senior living facilities for those who are older, that same licensing process is in effect. Okay?
thank you.
Any other questions?
Mr. Chair, I might add, being a licensed daycare provider early years of my life and then also involved in healthcare, we, most in-home and daycares are licensed through KDNHE. And I have several friends who own communities, and they're very happy to get information and to have help with assistance. Also, Home Plus are also licensed, and sometimes just not only through the state, but also through federal regulations.
Okay, thank you. All right, at this time, we'll turn to the public comment portion. Would the clerk, do we have anyone who has registered in person who's available?
At this time in person, we have no one. Because of the weather, we had sent a Zoom invite to everyone, and for the most part, those people have got on through Zoom, so we'll
Okay.
go through that list as virtual.
All right, let's begin with the first speaker then. I should make this note, again, public comments are limited to 2 minutes, and so if anyone runs over that time period, the chair is required to interrupt and conclude that conversation. So, first speaker.
We have Hillary McCoy. Hillary McCoy.
Good morning. Can you hear me?
Yes, we can.
Fantastic.
Go right ahead.
Okay. Well, thank you all so much for having this meeting and for raising this very, very important conversation. I have 4 children at Prairie Elementary, which is a Shawnee Mission elementary school. They range from kindergarten to 6th grade. And currently, as you know, in Shawnee Mission, middle and high schools have gone to mask optional. And if the county lifts this mandate, the elementary schools will follow suit. I'm very much in support of this mandate being lifted, and I'd like to raise several points for your consideration. The first is that the nationwide fatality rate for children is 0.00003%. That is 300 thousandths of a percent from COVID-19. And so that means that my children are much more likely to hurt themselves in a myriad of other ways. But as a mother, it frustrates me that the least vulnerable group has to be masked and covered when those who are always more likely to be impacted gravely by this disease have moved on. I see older people moving freely and unmasked throughout the community everywhere I go, and I support their choice. But because there's a lack of mandates everywhere else, church, urban air, the grocery store, restaurants, and movie theaters, children are free to live unmasked after school and over the weekends anyway. I don't see how a classroom with 18 to 25 repeat contacts offers anything other than a much safer and limited exposure than the community at large. In other countries like the UK and Japan and Scandinavia, children were only masked in schools briefly, if at all. Florida and Texas are two more examples of states where children have been maskless all year. They do not have numbers of gravely ill or dying children, or they would have changed those. Finally, my kindergartner's speech pathologist has told me that her ability to form letter sounds like R and the depend upon watching her teacher for the 35 hours a week that she's in school say them properly and connect them to the letters she's being taught. And she's having a lot of problems with that. And we are so blessed that we're able to have a private therapist. Many are not. And I'd like for you all to really consider those children as well. So thank you for your time and thank you for your help. And I hope we can move forward as a community together.
Thank you. Next speaker.
Now we have Becky Peck. Becky Peck.
Good morning. Can you hear me?
Yes, ma'am.
I'm Becky Peck, resident of Overland Park. What is our primary goal with students in school? Keep the schools open with the kids in their chairs. So why should we continue to mask if the numbers are dropping? It's boring. I know we're all bored. I'm bored. We saw the science slides from Dr. Areola. We aren't there yet with herd immunity. Only 33% of our children in elementary school are fully vaccinated. According to the CDC, we may be done with COVID, but COVID isn't done with us. I have a niece that's an elementary arts teacher. Last school year, when everybody was required to mask, there was only one non-compliant kid in her school. The parents picked up the child, took him home. The next day he returned to school compliant. They didn't have one other problem all year long. Respectfully speaking, she stated the only problem that they had was with the parents, not the student. There wasn't one COVID case in that school while they were masked. Now this school year, they're consolidating classes because teachers and students are out sick. They can't find substitutes. As an art teacher, daily she substitutes in regular classes because the classroom teachers are out sick. Students are out sick. School administrators are out sick and are also subbing. Everybody is subbing. Teachers are leaving the field. Teachers are discouraging students from entering the teaching field. So what are we doing to our teachers, our administrators, to the community? Everybody's tired. Just yesterday, Pfizer and Moderna both announced their boosters began to wane after 4 months. I would like for Dr. Areola to address that if he could. I had my booster 4 months ago. Our primary goal is keeping the schools open with the kids in their seats.
I'm sorry, your time is up. Thank you very much. Next speaker.
Now we have Michael Round. Michael Round.
Good morning. My name is Mike Round. I live in Overland Park. As the board will likely vote in just a few minutes to lift the mask mandate for K-6 students, to me, this may come as a surprise to many people who have, for the most part, moved on. And likely aren't even aware that last August 5th, not only did 5 commissioners vote for young children to wear a mask, but 3 of these commissioners actually voted for 3-year-olds to wear a mask 7 hours a day. This was done, we are told, not because they were vulnerable. They weren't. And with all due respect to Dr. Areola, flu for young kids is much more an issue than COVID, as Commissioner O'Hara said. The data is clear on that. But instead, to control the spread and keep our kids in school. As Dr. Areola said, masks were used not to protect the individual, but to control the spread. And that's where I think masks have done a tremendous disservice to people who are vulnerable. Because if masks worked for the individual who was vulnerable, we wouldn't have an issue. The vulnerable person would then wear that effective mask, but they're not. The commissioners are likely going to change their vote now, despite all metrics being 50% worse now than they were 6 months ago. But to the home rule issue with respect to school districts. Districts, the power is in your hands. Last July, you secretly asked the department, say something so we don't have to. To the Olathe School District, You've got a bond issue coming up. I understand it's the largest bond issue in history, nearly $300 million. You've required masks for K through 6. We have a harassment issue. Are there other harassment issues? We understand that critical race theory curriculum is being taught. And you elect to have this bond issue voted on in March, an off-election cycle. Say no to the bond issue until we can talk about it in November when most people will vote.
I'm sorry, your time is up. Thank you.
Now we have Cassie Woolworth. Cassie Woolworth.
Good morning. Can you hear me?
Yes, we can. Thank you.
All right. My name is Cassie Woolworth. I'm on Pinion in Olathe, and you've heard from me before. I want to address a couple of the points brought up earlier. What gives you the authority? Your charter gives you the authority. You are the Johnson County Public Health Department. Your charter allows you to do all of this. So let's just get over that hurdle. I also want to address that we don't know what's in Big Macs, Hot Pockets, or Go-Gurt, and we still eat those. The FDA protects us all. Flu is not as big of an issue when dying. And the masks have prevented flu both years. So not real sure about that one. Children who have visual impairments still learn to speak. Masking does not deter them. Apparently your special children need assistance. Masking is part of some religions. They also learn to speak, learn to read facial expressions. A study found before the pandemic found 3 to 8 children, 3 to 8 have no trouble identifying expressions. When others wear masks, it protects those who can't do it consistently. It protects our 0 to 5 who do not have options of getting vaccinated. If schools stop masking, they have more than 3 times likely to close if they stop masking. 3 times. Wearing masks helps prevent daycare closures. Wearing masks helps prevent teachers being out because they are sick. And it's not even that, it is the stuff after you get infected that we are doing to our children under 5. I know this is up for discussion today, but I disagree with unmasking.
I'm sorry, your time is up. Thank you very much.
Now we have Ben Hobart. Ben Hobart.
Ben, are you there?
You may need to press *6 to unmute.
You can go ahead, Ben.
Can you hear me? Can you hear me?
Yes.
Okay, thank you. Ben Hobart, Westwood Hills. It is time to eliminate the masking mandates. Omicron is a mild virus. Children do not have significant adverse effects from it. The flu season is at its end. Mask wearing can be optional for the immunocompromised. Dr. Mark McDonald, a California-based psychiatrist and best-selling author, sent a letter to his patients stating, effective immediately, all forms of child abuse would no longer be tolerated in my office. This includes masking children. My first ethical responsibility as a physician is to do no harm to my patients, and allowing children to mask their faces has caused and continues to cause tremendous harm to them physically, emotionally, psychologically, and developmentally. Any argument to the contrary is naive and irrational. Over the past year, referrals to speech and language therapists have increased by between 25 and 300% in locale. Young children have suffered a 24% decline along with a 22 IQ point loss among infants due to a combination of prolonged isolation, anti-social distancing, and universal masking of faces. This catastrophe is man-made and due entirely to the failings of adults. Unfortunately, in my adult patient population, many have developed a fear addiction. I strongly encourage them to remove face masks whenever possible, including when visiting my office, as a necessary first step in overcoming this fear addiction. That's the end of his letter. Please recall that the CDC and Dr. Fauci in the spring of 2020 and before indicated masks don't do anything. They may make you feel safer, but they don't protect you against the spread of viruses. then, well, you should wear a mask. Then 2 would be better. Then, well, 1 is enough. Now the masks aren't good enough. You need N95s. There are no independent experts orchestrating these control mechanisms. There are only narratives based on political science. Witness the hypocrisy at the Super Bowl. Adults unmasked, child orchestra masked. Stop the child abuse now. Thank you for hearing my comments today.
Thank you. Next.
At this time, we do not show that Daniel Austin is either present or on the Zoom call. So
Okay,
we will
we'll
move on.
We'll check back on that one.
Yes. We will move on to Seth Graber. Seth Graber.
Good morning. Can you hear me? Is my audio clear?
Yes, sir, we can.
Okay, excellent. Commissioners, Seth Graber from Lenexa, Kansas. I have spoken and written to you all before about removing the mask mandates. It seems likely that you all will vote to remove the current mandate for public schools later today. However, I want to be sure that we're removing for the right reason. Otherwise, we may be setting ourselves up for repeated masking and unmasking cycles for years to come, as COVID will certainly be with us forever. As I and others have pointed out previously, plenty of data exists which show masks worn in Johnson County and around the country are completely ineffective at preventing the spread of COVID. Everyone listening to me can perform a simple comparison of Johnson County and our neighbors to the east in Jackson County, which, unlike us, had a countywide mask mandate for adults and kids for most of 2021. If you compare the data, you'll see in your comparison there is no discernible difference in case rates. Commissioners, Dr. Arreola just told you all that wearing face masks are effective at preventing the spread of COVID. However, I and many others wonder if Dr. Arreola has read any of the scores of studies showing cloth face masks are indeed ineffective at that task. I urge everyone listening to decouple from the notion that following CDC guidance is, quote unquote, following the science, and encourage you to engage in real science by researching mask effectiveness, both pro and con, different types of masks and what they do, and engaging in critical thinking for yourselves. I hope that we all can commit to more information sharing and less censorship and mandates. If, like COVID, we breathlessly followed case rates for the flu, which, unlike what Dr. Arreola said, is more deadly to kids than COVID, we'd be tied to the same panic, comfort cycle that we are trapped in now. Commissioners, it's time to decouple from that data and treat COVID like the flu and other serious winter viruses. I leave with a quote from Governor Kelly, who just yesterday said, as COVID-19 becomes part of our normal lives, we need to continue transitioning back to business as usual. Thank you.
Thank you. Next.
Now we have Carrie Spake. Carrie Spake.
Hi, can you hear me?
Yes, we can.
Hi, my name is Carrie Spake and I am a kindergartner at Benlbert. I am in support of mask choice for our K-6 students. I have not spoken up until this point because I was waiting until I was confident that my position was supported by research. The data has consistently shown that the COVID risk for unvaccinated children is a flu-like risk and that vaccinated children have almost no risk of severe illness. Also, well-controlled real-world studies have not demonstrated a clear benefit of masking students. The WHO advises against masking children under 6 and only selectively under 12, which is followed by many Western European nations. Even the CDC acknowledges that cloth masks are not as effective at preventing COVID as other masks, which is what our children have been wearing. However, the negative impact of masks on our children has been increasingly shown and are compounding. Speech therapists are overwhelmed with students. Children are experiencing alarming levels of anxiety, depression, eating disorders, and suicide attempts. As one doctor of public health at Harvard said, kids are resilient, but not endlessly resilient. As a society, we have obediently followed what the health officials have asked of us. We stayed silent when we were told to stay home for 2 weeks to slow the spread. We stayed silent when that 2 weeks turned into months. We stayed silent when schools shut down, lunch programs halted, and all extracurricular activities for our kids were canceled. We stayed silent as universal masking of our children in schools occurred in order to get our children back in school, despite the clear data at that time showing how little affected our children were by COVID. We stayed silent as masking our children continued after the most vulnerable in our population became vaccinated and boosted, and we continued to stay silent as our children became vaccinated but still had to wear masks. How much longer can we stay silent? If we don't speak up for our children, remove all mask mandates now, then when? It's time to start considering the mental health of our children and give them a normal school year. Those who want to wear masks and think they're effective can continue to wear masks. It is time to give parents the choice. It's time to end the mandate. Thank you.
Thank you. Next speaker.
Now we have Debbie Detmer. Debbie Detmer.
Can you hear me?
Yes, we can.
Hi, I'm Debbie Demmer, a grandmother of 8 and a retired registered nurse. You have overreached your powers on these mask mandates. I know you are aware of this travesty, as it was stated by Commissioner Kalicki in August of 2020 and agreed to you by Commissioner Eilert. Now it has been ruled by Judge Mason last week, case number 21CB4186, Johnson County Parents versus Johnson County Board of County Commissioners. It strengthens the point that the school boards have the home authority under the Kansas Constitution that grants the school boards the power to maintain the facilities, Brancle 211 and Kansas 917. The BOCC's council also agreed with this point. Essentially, the parties agreed that the school districts have the final say on the mask mandate issues. So it's not the BOC's orders that caused the plaintiff's injuries. Instead, the school district's decision to require the plaintiffs to wear the mask caused the injuries. So please stop the overreach of the mask mandates today and let our kids breathe freely. And again, on another note, Senator Mark Steffen is asking KU doctors to join a symposium with our doctors on March 2nd at 2 p.m. I hope Dr. Lamasters and other KU doctors have the courage to show up. And it would be great if you commissioners were present as well at this symposium. My hope is that in this discussion, the KU doctors and the hospitals can explain why they did not use their individual critical thinking skills and choose to treat the symptoms of the patient. Early treatment has always been a priority in medicine and cancers and many other diseases. Instead, the KU doctors and hospitals are telling the sick to go home, do nothing, until you're sufficiently distressed, and then come back and we'll get you remdesivir on a vent and kill about 40% of you. Just following the CDC guidelines is not sufficient answer to any of this, and I hope they show up.
Thank you.
Now we have Jenny Cox. Jenny Cox.
Can you hear me?
Yes, we can.
Jenny Cox, Overland Park. Today needs to be the day that you drop all COVID measures. Do not delay. Weston Churchill, in a letter to the writer H.G. Wells in 1901, Churchill wrote, "Nothing would be more fatal than for the government of states to get into the hands of experts. Expert knowledge is limited knowledge, and unlimited ignorance is the plain man who knows only what hurts, is a safer guide than any vigorous direction of a specialized character. Why should you assume that all expert doctors, engineers, etc. are drones or worse? If the ruler is to be an expert in anything, he should be an expert in everything, and that is plainly impossible." That was his quote. And so if we are going to listen to experts, why don't we listen to speech therapists that were and are saying speech delay and problems are rampant? What about psychologists and counselors that can't keep enough office hours? Why didn't we listen to the 50,000 doctors that directly opposed all of these measures by signing the Great Barrington Declaration on October 4th, 2020? You may not agree that rights were violated when COVID mandates were thrust upon us. You might have thought that this is what we must do and that the experts would guide us. You may be acting upon a religion of sorts that you rely on further up the ideological chain than what we speak about here today. But regardless, you've struck a nerve with many in Johnson County. Thank you.
Thank you.
Chair, that completes our public speakers.
Is Mr. Austin available at all?
No, he has not got on Zoom, and he is not in the hallway. Thank you.
Well, thank you very much. That concludes our public comment portion. I would say this, we've received many emails over the last 2 or 3 days, folks expressing their opinion on both sides of the question. Thank you very much for those communications. And we've also had some printed public comments also. So appreciate all the communication that has come to us. Commissioner Myers, did you have a comment or question?
Yes, thank you, Chair. I wasn't going to make a long statement, but I do want to be heard, and I'll make it succinct as possible. When some comments are made by commissioners on this dais, I don't want it to be representative of all. It should be as individuals. But I will make this statement that this pandemic has not been a game of dodgeball. It has not been about politics. It's not a game at all. I know as a commissioner, what I do is I try to take the information, the data, the research that I do, and the personal experiences that I have to try to make the best decision I can personally. And that is what I've done. And today I am supportive of dropping the mask mandate. I still believe in intervention. I still believe in mitigation. I think that should continue to the best of our ability. But I do believe that the mask mandate time is able to come to an end. I want to thank Dr. Areola and his staff. Your work is not done, as you stated, but you have done an unbelievable job in all of your actions that you have taken to help us in this pandemic time, and it's going to continue. And I do think things are definitely going on a positive direction. I want to thank our teachers. A special shout out to our teachers, our school staff. You are heroes. We all know that our health care providers are heroes. We know that our safety service department people are heroes. We have so many heroes in Johnson County. That's why it's such a great place to live. So I will stop at that point. I will make other comments during my time as commission comments, but that is my statement for today.
Well, Commissioner, thank you. I would second those comments. Mr. Ashcraft.
Thank you, Mr. Chairman. I have to reflect, this has been the longest year in my life. 2020 turned into 2021 and now into 2022, and it's been like the great pause in terms of everything that I've been involved in. It's been rough, and I think we've all suffered, regardless of where you fall out on these issues, and we're facing, I hope, another transition away from the onus of COVID into I hope a return or a new, more vibrant, more prosperous, more relaxed and enjoyable future, a better normal. During this time, one of the things that I have had an opportunity to do is read and consider COVID and how it's impacted us versus how other pandemics have. And one article I read talked about that there are actually two ends of a pandemic. One is biological, in which the pandemic becomes endemic. And it talked about the flu of 1918 and 1919, that biologically it evaporated, it morphed, it changed to where it no longer existed in its original form. The other is social and cultural. So even though the disease itself may have changed, the society which it affects has to change and has to move beyond what occurs and how it had impacted it. And we're kind of at that point, I think, globally, nationally, and for us locally. And as you noted, Mr. Chairman, I think we've all received concerns, people who want to move on now, 6 months ago, 2 years ago, and those that want to wait to have further discussion, further consideration of masks and other interventions. And that's going to continue, and it should continue, because depending on who you are, you have different needs and different expectations and different worries, and I understand that. I am going to support this. I think it is arguably overdue, but I understand the evolution of that social, cultural need to work through this. I think all the relevant indicators, not just locally, but as I've seen nationally and internationally, suggest that we have moved beyond it being a pandemic. It will continue to be here in some form, and we will have to guard against it, as our staff has indicated and many experts have indicated. We have to be vigilant at some level. But these mandates and these interventions, I think, have taught us a lot, and it's been problematic in so many ways. And I'm glad to see this transition and am supportive of removing our little piece of the mandate and hopefully get back to a more pleasant, constructive, and meaningful way of conducting ourselves. So thank you, Mr. Chair.
Thank you. Commissioner Allenbrand, you have a motion you indicated.
I do, Mr. Chair, but I'd like to make one comment. First of all, I want all the commissioners to know I appreciate their comments, but I want to echo Commissioner Meyer's comments about the heroes, and I would just like to add the paras that work with special needs children, and also our staff, because it took a village to get this done. I move the Board of County Commissioners sitting as the Board of Public Health to rescind the Public Health Order 001-2021 requiring students 6th grade and younger in Johnson County schools to wear masks effective today, February 17th, 2022.
Do I hear a second?
Myers, second.
Myers had the second to rescind the public health order as noted. Commissioner Hanslick and then Commissioner O'Hara.
Thank you, Mr. Chair. I appreciate the opportunity. I especially appreciate Commissioner Meyer's comments, and I agree with them. I do have to say this has been a very, very difficult decision. I have agonized over it because I do talk to a lot of families who have children who, without the mask requirement, are very concerned about the vulnerability of their children. However, as I have done throughout this pandemic, I turn to our public health experts and our public health officials, and I've had conversations with Dr. Areola, and I've come to the conclusion that with at least 4 of our 6 school districts putting triggers in place to allow return to masking, that we're not just kind of throwing our hands up in the air, that there are some measures in place to keep us from going off the rails, so to speak. And also because of the way that the Johnson County Department of Health is working so closely with our schools. I appreciate that they have been working with individual schools, individual classrooms, and they're going to actually continue and strengthen and expand that to make sure that children in those situations, especially those who are vulnerable, as well as we have vulnerable staff in our schools, that those situations can be tailored to provide the most protection for them. I think also the reassurance that vaccines are widely available, that the county is providing effective masks for the schools to distribute to those children who want them, and also that the Board of County Commissioners, this situation today does not mean the pandemic is over. It doesn't mean we will never have to revisit any efforts or any orders in the future. Again, as I've done throughout the pandemic, I will continue to follow the guidance of our public health officials, and if need be, I would be very supportive of future action as necessary to protect the health of our community. But finally, I want to make an appeal to our community. You know, throughout the pandemic, I've heard many times people say, trust people to make the right decision, trust people to make the right decision. And the right decision is always to respect the needs and vulnerabilities of others. So even if there is not a requirement to wear masks in schools, I'm appealing to people to be cognizant of the people around you who may be vulnerable. Children in your classroom, in your children's classrooms, do they need for you to be wearing a mask while you're near them? Teachers, school staff, be kind. If you know someone is vulnerable, wear a mask when you're around them. Even if you don't wear a mask all the time, think about those people who may be more at risk than others. That there's no mandate that can make people do the kind and the compassionate and right thing. But I hope people will look into their own hearts and make those decisions so that all of our kids can feel safe at school with or without a mask mandate. It shouldn't have to be a mandate to do the right thing. So thank you.
Thank you. Commissioner O'Hara.
Thank you, Mr. Chairman. I will have a motion after we deal with this issue, and this is on how the health department interfaces with child care facilities. So I just wanted to let you know that I will have another motion for us setting as the Board of Public Health.
Okay. Well, let me suggest this. I think what you're talking about is something that all of us need to understand with more clarity. And I do understand that there is a relationship with KDHE that we have a responsibility to carry out. And I would make this suggestion that next week under reports and communications that we explore that issue, and before taking any official action, I think we need to understand the various aspects of that relationship. So I would ask you to hold that motion, and we will discuss that next week under reports and communications. Thank you.
This motion would not undercut any legal authority. It would simply make sure that the elected officials are in the loop, and that any measures that would suspend operations would need to be approved by the Board of County Commissioners sitting as the Public Health Board.
Well, again, you can make that motion today if you want. I would oppose it and would encourage others to do the same thing until we have a better understanding of the impact thereof. So the
I will
motion,
be making a motion, but thank you.
The motion that's before us is to rescind the public health order in regards to the 5 to 11-year-old age group. Any other comments? All right, if not, would the clerk please call the roll?
Chair, I'd like to note for the record that this motion is set, that the board is setting as the County Board of Health.
That is correct.
Commissioner Fast.
No.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Eilert.
Eilert, aye. I have 6 votes in favor, 1 opposed. The motion carried. Thank you very much. Commissioner O'Hara, did you have a motion?
Yes, and thank you for recognizing me. I really appreciate that. I move the Board of County Commissioners, sitting as the Board of Public Health, to direct the county manager to limit Johnson County Department of Health and Environment from imposing mitigation measures on child care programs which suspend operations unless approved by the BOCC, sitting as the Board of Public Health.
Okay. Is there a second? There is no second, so the motion dies for lack of a second. I'm going to take a call for about a 5-minute break. We will come back and complete our agenda and agenda review. Thank you all very much. Thank you.
Thank you, Mr.
Recording in progress.
All right, at this time, we will reconvene from our recess to complete the rest of our action agenda. I think we're ready for item number 3.
Resolution number WD 22-002. Conduct a public hearing and consider authorizing funds for the Mill Creek Storage Facility, MCR 1-CO25, design and bid phase services in an amount not to exceed $2,568,500.
The public hearing is open. Ms. Pekarik.
Thank you, Chairman and Commissioners. Susan Pekarik with Wastewater this morning. We have a few figures here to facilitate the presentation. The Mill Creek Regional Wastewater Treatment Facility serves the northern and central portion of the county. That includes the Mill Creek watershed, Cedar Creek, Cedar Mill, and Tule Creek watersheds. We've got a map here of the service area outlined in red for you, and you can see the wastewater treatment facility there located up in the northern central portion of the county. The main trunk sewer that brings flow from homes and businesses to the facility to be treated was originally designed for approximately half of the build-out in the Mill Creek watershed. Development in the watershed has approached this point, and in 2017, HDR Engineering performed a capacity analysis on the sanitary sewer collection, and they did find that portions of the system are at capacity and improvements are needed for future growth in the watershed. Got a figure here. So this figure is of the service area Mill Creek watershed, and you can see some of the hatched areas here where we'll be conducting work to do I&I removal and treatment facilities up here at the upper end. One of the improvements that was identified was a storage facility, storage tank located within the system near the confluence of the Mill Creek and Little Mill Creek sewer interceptors. This storage facility will receive flow that's been diverted from the system during a storm event to help attenuate the peak flow through the pipes. And then once the storm is over, that flow will be released back into the pipe to travel back down to the Mill Creek Regional Treatment Facility. A close-in version here of that. The pink area here is that storage facility that we're talking about. This storage solution avoids building additional interceptor pipe to the treatment facility. There would have been about 2 miles of pipe that need to be constructed. And it would be disruptive to the community and to the environment. In addition, the storage solution costs about $50 million less than the parallel interceptor sewer. Staff evaluated several sites for the storage facility. This proposed site that we have on the screen here is located on Johnson County Park and Recreation land, as well as property that's owned by the Parks and Recreation Foundation of Johnson County. Wastewater staff discussed the project with both boards in January, and both are supportive. Johnson County Parks and Rec staff is also supportive. I want to take a moment here. Penny mentioned this last week in agenda review, but I do want to thank the Parks team, Jeff Stewart, Bill Mawson, and their teams. They've been extremely helpful at helping us get to this solution. Once the details of the property acquisition, and we'll be acquiring this property here that's owned by the foundation. There are 5 parcels there. Once the details of that, as well as easement here through the Johnson County Parks and Rec property, once those details are known, we'll be bringing that back before the board for acceptance and funding. This will give us an opportunity as we're creating this access to the storage facility. We'll also be providing some improvements through this area to help create this access. Burns & McDonnell, who's one of our engineering term and supply firms, will be providing the engineering, design, and bid phase services for this project. They were selected through a mini RFP process where we offered the opportunity to provide an approach to this project to the 7 firms that are under our term and supply engineering contracts for work of this type. Wastewater staff and HDR Engineering evaluated the proposal, or approach, I should say. Funding for this request includes design and bid phase services. Staff will return to the board once the project's been bid for construction phase and construction contract award. So the requested amount today is $2,568,500. This project is included in our capital improvement plan and in our financial model, and that was presented most recently in May of 2021. I'll be happy to answer any questions.
Okay. Well, again, I would second your comment about the Parks Board and Park staff for cooperating in this effort. Appreciate it very much. Other questions or comments, Mr. Ashcraft?
Thank you, Mr. Chairman. Yes, Mr. Chairman, I appreciate you saying that because, you know, it makes sense to leverage public lands that are already used rather than going down and taking other properties off the tax roll. So I commend you for that, and the location seems to make sense. So you and your staff, I appreciate your and the Parks
and
all the others for working together. I think that makes a lot of sense. I guess we probably have a good representative from the Board of County Commissioners on the Parks Board, so that may have helped a little bit.
Mr. Myers?
No, I'm not done.
Oh, excuse me.
I'm sorry. I was just tipping my hat to Mr. Myers and his persuasiveness. And I also wanted to thank staff. Ms. McCarrick called it a mini RFP process, and Mr. Chairman, I had the opportunity to visit with her and her staff a little bit yesterday. The 7 firms that are on these term supply contract entered into a quasi-competitive arrangement to see who could do the work best, most responsive, and I'm, as I understand it, to provide the best value for the project. So I commend staff for doing that. The one question I wanted to ask, though, is, as I understand it, and Ms. McCarrick, please elaborate if I misstate this, once Burns and McDonald, Burns and Mack, if they are selected, then they no longer will be eligible for any other projects in this group of 4? Is that correct?
Yeah, and I'll clarify a little bit. So the contract, the term and supply contract for the engineering wastewater treatment engineering services, that includes essentially most or all of the projects that we include in our capital plan. We had identified 4 projects, this one being one of them, that were larger projects, so that's why we went through the additional competitive process. And so you are correct. We shared information about these 4 projects with the 7 firms, and then made it clear that, you know, they could really just work on one project. There will be other smaller projects that Burns McDonald may be working on through our capital plan, but of the 4 that we issued for the mini RFP process, that's correct. It would just be one.
Well, thank you for that clarification. I think what I was struggling with, Mr. Chairman, is, and I'm not trying to advocate for Burns and Mack one way or the other. If they're selected here, fine, but why would that necessarily disqualify them from these other 3 projects if they indeed could be or would be the most competitive, the most value-added alternative? So help me understand that a little bit.
Yeah, and I appreciate that. You know, we discussed the term and supply contracts quite a bit here. And the reason we took this approach is that we felt this was most fair in terms of being able to spread the work out amongst the 7 firms that we have under contract, and so that's why we elected this approach. And as I mentioned, I think we provided information about the 4 projects that we were intending to utilize this mini RFP process on, so that they could take a look at their skill set and which ones they felt like they might be best suited to provide a proposal for. And they also had the opportunity to team, so there are opportunities for more than one firm to propose.
Okay. So my understanding is your thought process was try to make it fair for the firms, but how do we make sure that we have the best value proposition for for the ratepayers?
Yeah, no, that's a great question. So HDR Engineering is our program engineer, and so they're working side by side with our staff, and they're evaluating the proposals, and in this case, the fee that was proposed by Burns McDonnell. HDR Engineering had estimated the fee might be approximately $2.7 million, but Burns McDonnell proposed something in the range of $2.2 million. So we've got HDR essentially working alongside us, looking at the proposals and helping us evaluate. So we are able to identify the best value for our ratepayers.
Okay, all right, thank you.
And HDR is not on the term and supply contract. I want to make that clear as well.
Okay, thank you. Mr. Myers?
Thank you, Chair. Thank you, Ms. Peck, to you and your staff. I also agree with this approach, and I think the location is appropriate. And I, as always, do appreciate JCPRD leadership and the work that they do in conjunction with everyone here at the county. I guess the one question that I ask often is there any type of odor associated with this project prior, during, or after construction of the project?
Yeah, that's a good question. So this storage facility will be used, maybe a handful of times, depending on, how many extreme events that we get that would exceed our design or the capacity of the interceptor. There will be odor control included as part of the project, just for that reason, so that we have the ability to control those odors.
Okay. Did we have anyone who designated they wanted to talk to this issue?
No, sir.
All right, Commissioner Fast or Commissioner O'Hara, any comments at this time? All right.
No.
Yes. Okay. Do I have a motion, Ms. Allenbrand?
Oh, I'm going to let Mr. Myers do the motion, but I had a couple comments.
Go ahead.
First of all, I want to thank Ms. McCarrick and her staff for this outstanding job. And again, I can't echo enough the partnership with JCPRD and being past planners on a couple of different boards. This is exciting and I think award-winning, innovative idea. And not only this, but you've also saved a lot of money to the taxpayers. So that's highly appreciated. Also, I've received several emails, people thinking that there's bad water runoffs, and could you explain that I know you test that and that you guys, that's why we have all the engineers, but could you just publicly say how that's being taken care of?
Sure. So in Johnson County, and maybe just kind of back up to Johnson County Wastewater provides sanitary sewer service, and then stormwater is managed by the cities. And so sometimes stormwater runoff can be confused with wastewater and vice versa. One of our performance indicators that we track are backups and overflows, and we have levels of service that we've established in terms of how we want to, or how we will serve our ratepayers. And so you are correct. If there is a storm event, something that would cause an overflow, then we are out there collecting samples and making sure that the water quality in the streams that may have been impacted, making sure that we're testing that and understanding. Typically, our crews are going in and we're removing as much of that water or overflow water if we do happen to have a situation like that, and then we're continuing to test that until we're back within the water quality standards. But I will say that we exceed our performance indicators annually, and we talk about that when we present our capital improvement plan and provide an update on the integrated plan, and we'll be doing that again this year.
I really appreciate that because I think there's some miscommunication out there about testing going on. So thank you so much.
All right, thank you very much. Before I ask for a motion, there are no other comments. The public hearing is closed. Mr. Myers, motion would be in order.
Thank you, Chair. I move the board adopt resolution WD 22-002, authorizing funds for the Mill Creek Storage Facility, MCR 1-CO25, design and bid phase services in the amount not to exceed $2,568,500.
Hanslick, second.
Myers made the motion to approve the resolution in regards to Mill Creek Storage Facility. Hanslick seconded the motion. Are there any further comments or questions? Mr. Ashcraft?
Thank you, Mr. Chairman. Mr. Chairman, as you know, I've had some sensitivity about term supply contracts, but I wanted to commend staff for, as Ms. McCarrick called it, the mini RFP process. That's definitely a step in the right direction to encourage vendors like this within a limited pool to sharpen their pencils, as it were. So I appreciate that very much. What I'm stuck on is the automatic exclusion of the vendor just because they won the first one, not to be considered for further ones or excluded, as it were. So I'm just not convinced of that process step, so my vote will reflect that concern.
All right, any other comments? If not, clerk, please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
Yes.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
No.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Eilert.
Eilert, aye. I have 6 votes in favor, 1 opposed, motion carried. All right, next item.
Item number 4, resolution number WD 22-008. Conduct a public hearing and consider authorizing additional funds in the amount of $545,758,840 for design and construction of the Nelson Wastewater Treatment Facility Improvements Project, NEL Contract 01, increasing the total project authorization amount to $574 million.
Public hearing is open. Ms. McCarrick.
Thank you, Chairman and Commissioners. Susan Pekarik with Wastewater again. Linda, if we could pull up the PowerPoint slide deck that was with this item, that would be great. Thank you. So the request before you today is a request for project funding approval. This will allow the county to proceed toward the final agreement with EPA. Excuse me. No. Okay. Excuse me for one moment. Just pull up whichever one you have and I'll just, thank you. I apologize. So this is required, this is part of the steps toward working toward that final agreement for the WIFIA loan, which is part of the financing strategy for the Nelson project. So I have a few slides here I'll walk through to help facilitate this discussion. No. Do you not have the PDF? I'm sorry. Here we go. Right here. I'll use this. Oh. Do you have it? Okay. I apologize here. There you go. That one right there. Thank you. Thank you. All right. Thank you for that. So just as a reminder, the Nelson Wastewater Treatment Facility is the oldest facility in our system. It dates back to the mid-1940s. It is at the end of its useful life, essentially, and the existing technology will not meet future water quality requirements. It has a technology that was similar to Tomahawk before we renewed it. The regulatory driver for Nelson was really the key part in us developing an integrated plan so that we could ensure we can take care of Nelson as well as other needs across our system. This is a reminder, this is our 25-year integrated plan, and we have Nelson circled there so you can see how it fits into the plan. We were able to work with the state to negotiate finishing Tomahawk first and then moving to Nelson before moving on to other Mill Creek facility upgrade in the future. The key here is Nelson is just one part of many projects that we're accomplishing within this plan. So we do plan to utilize WIFIA, which is Water Infrastructure Finance and Innovation Act. WIFIA will cover 49% of the project cost. There are several advantages to WIFIA that we have talked about previously, and I'll just go through them here quickly. WIFIA is a low-interest loan that's tied to U.S. Treasury rates. It's very flexible, so it allows for customized and extended payment schedules or payment options. We can delay initial payments. We can refinance one time should the rates drop, interest rates drop, and we haven't taken any draws on the loan. It also provides us early cost certainty when it comes to financing half of the Nelson project. And it's really the key to our strategy for overall for Nelson, key to our spending strategy. So that spending strategy that we have for the Nelson project is really driven by a philosophy to keep total borrowing costs as low as possible while staying within our financial plan revenue adjustments. We also want to make sure that we're maintaining a solid bond coverage ratio, but making sure that we're flexible so that we can adapt to any unknowns that might come up. So the plan that we've discussed here, we've been, wastewater staff, budget staff have been working with the county's financial advisor as well as bond counsel. And so the plan that we've laid out here is that we'll have WIFIA. We'll be able to arrive to an agreement here in April, and I'll go through that schedule in a little more detail in just a moment. That will allow us to lock in that rate in April. The other thing is that we will utilize a GO bond issue this year, again, to take advantage of the interest rate market currently. And then we would, because of the WIFIA flexibility, then we would not be drawing on WIFIA until 2025, even though we're able to lock in the interest rate this year. And then we would round out the project with another bond issue in 2026, 2027. The great thing about WIFIA and its flexibility is that if the borrowing conditions remain favorable, then we can actually push WIFIA out a little farther and do another bond issue in 2025. But really, this strategy that we've laid out here, when you compare that to a second traditional bond issue where we might be doing that in the middle, where we've laid out WIFIA draws, that can save us as much as $66 million in borrowing costs compared to a more traditional bond issue. This is the improvement schedule that we have for the project. These blue stars represent action items that the board has already taken. You can see this year we'll have a couple more action items coming before you. We're here today, and then we'll return again to wrap up WIFIA this spring. Construction, while we expect to have some early packages, we want to optimize the early packages so we can optimize getting the project done. We expect the bulk of the construction will occur 24 through 29. And I failed to mention here, EPA is working with us so that we can get this loan completed this spring, again, taking advantage of the current market. And so here we are at our schedule for the project. We have the project funding request, and so working through this WIFIA loan agreement, the process looks very much like a typical GO bond issue where the project must be approved in order to complete the agreement. The way the Kansas law works is that the board will consider a bond sale for the WIFIA agreement, and that's actually the next agenda item for your consideration. And then at the same time, our staff, the county counsel, Gilmore Bell, as well as the financial consultant for the county, we've been working alongside EPA, working on language toward that final loan agreement. We expect that will be completed by March 1st. And then EPA has an internal review process that takes approximately 45 days. And so we anticipate bringing the final loan agreement back before the board for consideration April 14th. At that time, we can lock in that interest rate for the WIFIA loan. So in summary, Our request today is for the board to authorize the additional funds for the Nelson project in the amount of $545,758,840 for the project for design and construction, which will increase the total project amount to $574 million, which was the application that we made to WIFIA. The loan amount for WIFIA will be $281 million. This will allow us to then proceed with that financing agreement, and it does help us mitigate the possible risk of rising interest rates for the project for our borrowing costs. And with that, I'll be happy to answer any questions.
Ms. McCarrick, the increase in the cost that you've outlined, I understand some of it is inflation, but there are other factors also involved in that increased cost. Could you mention?
Yes, absolutely. So we included with the increases, we have also included, there are projects that are included within our capital plan. So there were projects we're already going to do, but we included them with the application. So there's about $30 million worth of capital projects that we brought into this project for necessary coordination with the Nelson project. In terms of, you mentioned the extraordinary escalation. So we've been talking a lot about the volatile market out there, and we have about $60 million included for that. It's escalation and contingency. About $10 million of that is associated with American Iron and Steel, which is part of the WIFIA program, and then about $50 million of that is associated with this extraordinary escalation associated with the volatile market right now associated with construction materials.
Okay.
And
Thank
then
you. Well,
the other pieces are smaller, $5 million for collection site, which was already included or planning to be included in our operating budget. So it's a move from operating to capital, and then a force main and some smaller electrical improvements, about $5 million there. Excuse me.
Yeah, well, I don't think there's any doubt, as soon as we can lock in the interest rate on the WIFIA approach, I mean, the Fed has already stated that there could be several rate increases this year. So good time as quickly as we can. So other questions, Mr. Ashcraft?
Thank you, Mr. Chairman. Ms. McCarrick, you are dutifully sensitive to the volatility in markets, so I appreciate that, and I'm very supportive of this effort. But one clarification, are there any particular federal or state entanglements that provide or impose anything unnecessary or onerous on our project, any additional regulations or costs? I think it's with all said and all due measure, it's still a good deal. But is there anything that may surprise us or may be forthcoming because of the use of this loan?
Are you referring to, I mentioned the American Iron and Steel. That is a requirement that's part of the WIFIA program. Other requirements include things like Davis-Bacon wage rates. However, those typically, for a project this size, we don't see an impact of those requirements. So.
Okay, very good. Thank you.
Commissioner Allenbrand, then Commissioner O'Hara.
Thank you, Chair, and I want to say again, thank you so much for this detailed report, and the millions of dollars that you're going to save is just exhilarating, and I want to thank you and the staff. And I'm sure that this is contributing because Commissioner Myers is the liaison on your committee as well. So good job, Myers.
All right, thank you. Commissioner O'Hara.
Thank you. We have $170 million in reserve for wastewater, and I want to know how that is going to be used to perhaps limit the amount of money that we have to borrow on this project.
So I thank you for the question, Commissioner. So as we provide to the board during our financial plan presentation every year, You may recall we have two funds, the operating fund and the capital fund. And so our intention of using reserves for this project as well as other, the rest of our capital plan is to work within the policies that have been established for both the operating fund and the capital fund. And so we show you a spend down plan during those presentations for the operating reserves. We always want to make sure we've got a soft landing there. So we're typically, the policy states not below 90 days, and so we're typically working our way down to a soft landing of 90 days. So that's how we utilize. It's an important point. We do evaluate that every year as part of our financial plan, and we share that with the board.
What's the 90 days number?
I'll have to get that for you. I'm sorry, I don't know.
Okay. I am very concerned how this has increased. When I was sworn in, we were at 426, and now we're at 574. However, I had, as soon as I was sworn in, I was talking about inflationary pressures. But I think that this is an opportunity to add to this that we will require a financial audit on all of the construction contracts and the payouts. And this is an enormous amount of money. It's $500 million, more than $500 million. And I just want to make sure that our reserves, if we do have reserves available to soften the impact of this $574,000 or $574 million project, that we use them very judiciously. Again, I think that we need to have a financial audit in place with this kind of outlay. And I think that that's just transparency for everyone. Those are my comments.
Okay, thank you. Do we have anyone who wishes to speak to this item?
Yes, we do.
All right.
1 second.
Can you hear me?
Yes, we can.
Stephanie Berlin, 972 East 120 First Place. I'm requesting the BOCC approve an independent financial audit of Johnson County wastewater. Weekly, I hear from this dais that they have concerns and reservations about the bidding and contract award process. As a taxpayer, what am I to think? I heard in the news of possible accounting irregularities within the county. What am I to think? I see a chair trying to say that the county does do internal financial audits when he is on record at the audit committee meeting saying they do not. What am I to think? I see a BOCC willing to spend $500,000 on a single piece of art, but no audit for a $500 million project. What am I to think? I see a charter commission that could have changed things like this, filled with lawyers and politicians who release a report with no recommendations or amendments, and they believe they did a great job. What am I to think? I see big projects like this being posed at public hearings when everyone is at work. What am I to think? I'll tell you what I think. I don't trust you. I don't care if you have toured a plant and it is beautiful, because for that kind of money, it darn well should be. It needs an audit, basic financial and fiscal responsibility by our elected officials. I see listings of internal financial reports on Wyandotte and Sedgwick websites, but for the $1 million I pay, zero. Hire experienced, qualified, and skilled people to do internal financial audits. If this is not approved today for wastewater and for this project, every taxpayer needs to ponder why the request of an independent audit for $545,758,840 is rejected. What are we to think?
Okay, thank you. Is there anyone else?
No, sir.
All right. That being the case, the public hearing is closed. A motion would be in order.
Is Mr. Myers, you going to do the motion?
Mr. Myers?
No,
Okay, Ms. Allenbrand, you have a motion.
Sorry. I move the board adopt resolution number WD 22-008, authorizing additional funds in the amount of $545,758,840 for design and construction of the Nelson Wastewater Treatment Facility Improvements Project NEL-Contract 01, increasing the total project authorization amount to $574 million.
Second, Hanslick.
Commissioner Allenbrand made the motion. Commissioner Hanslick seconded the motion in regards to the increased contract for the Nelson facility and the resolution as presented. Any further questions or comments?
Mr. Chair, can I make a comment?
Yes, go right ahead.
Ms. McCarrick, I know that you have measures in place with your contracts and you have a bidding process. Could you go over your internal audits, the way you handle your design work? Because I know that you guys are doing that, but I would like the public to know.
Sure. Are you speaking about the financial piece or about the?
If you do a project, I know you have a budget and that you monitor that very closely and you have devices in place.
Correct. So I'll speak to what wastewater does, and then others might speak to what the county does, county auditing does. So, for example, on this project, we hired a construction manager at risk. They're actually in the process of developing a guaranteed maximum price to build the project. We have a design engineer who is, the CMR is working alongside the design engineer. Both of those were selected through a competitive process. We'll return to the board for consideration of the contract to build the project. But a typical process is we'll go out to bid for a construction project. And then once the contract is awarded, whether it's a design engineer or a construction contractor, they're providing an invoice that includes a schedule of values for the work that they're doing. The design engineer also provides construction phase services. So they are monitoring that work that's done and then they're verifying what we're being billed for each month from the construction contractor. That information is then provided to our staff, and so then there are several steps that go through our staff before that invoice is finally approved for payment. The county does an annual financial audit, which I believe one is in process right now, so I can let someone else speak to that if that's something that you would like them to do. But you are correct. There are several checks and steps along the way that include both the wastewater staff as well as the consulting engineer to ensure that the work that's being done and what we're being billed for match.
Okay, thank you. Commissioner Ashcraft.
Thank you, Mr. Chairman. Ms. McCarrick, this action today is to approve the processing of the WIFIA request. As I understand it, we will have further discussions about the project build-out and costs and management. This is basically to give us some assurances or attempt to give us some assurances that as the market fluctuates, and unfortunately I have to agree with the chairman on that, it is volatile, but to try to capture the best interest rates before they get out of hand. Heaven forbid that the chairman's right about that, but he may be, plus construction costs. So I'm not seeing the concern that I've heard expressed. So I am supportive of this, although I would ask as a sidebar, I'd like to learn more about the $66 million and how that's calculated, but we can discuss that offline. So good job and go forward.
Okay, thank you. Commissioner O'Hara.
Thank you, Mr. Chairman. I would just like to add, when it's appropriate, I would like to add an amendment to this motion that our internal auditor would do a financial audit of all of these contracts and the payout, because things do happen and we need to make sure that we have every safety standard available to us to make sure that the public's money is being spent wisely. especially in light of the $1 million that has gone missing at the district court clerk's office. So I would just ask the board to just consider that. As I've said before, our chief auditor, Harry Heflin, has indicated that this limited scope that our audit office would be able to handle. And I think that it would just give me as a commissioner and the public at large a lot more comfort to know that this more than $500 million project will be watched very closely.
Okay, thank you. Any other questions or comments, Mr. Ashcraft?
Mr. Chairman, just to follow on to Commissioner O'Hara's observation, we had discussed something similar to this briefly last week or 2 weeks ago about getting some kind of feedback from the new county auditor in terms of what they might do. Have you been able to, has the audit committee been able to pursue that?
Yes,
And
again, I made this statement, I think last week. Financial audits sometimes are in the eye of the beholder, and my conversations with the new chief auditor is that there are some financial aspects to the audit they do, but it's based upon performance and compliance. So when there's a financial aspect to it, that is included. But I think if we're going to do an extensive financial audit, we'll have to make additional contracts. And, at our next audit committee meeting, that will be a point of discussion.
Very good. Thank you, sir.
Mr. Chair, can I ask something?
Go right ahead.
I've been getting several emails about this $1 million missing from the DA's office, and I don't understand what that is. Can somebody clarify that?
Not the DA.
Well,
She said.
The court.
yeah, we're a little off topic on the item that's before us.
Sorry.
So following action on this item, I'll be glad to
Thank you.
respond to that.
Sorry.
The public hearing is closed. We did have a motion, or do we have? We did have a motion, right?
I made the motion.
Okay, and the second. So if there's no other comment or question, clerk, please call the roll.
Chairman,
Yes.
I do have an amendment that I want to, I make the motion that we have, that we instruct our audit department to audit the expenditures from this $574 million.
Yeah.
And to report back to us.
Well, as I suggested before, the audit committee will take that under consideration at our next meeting with the auditor. So thank you for that comment. Clerk, please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
No.
So they're not doing the audit?
Commissioner O'Hara, what was your vote? Yes or no?
No.
Pardon?
No.
Okay.
Commissioner Hanslick.
Hanslick,
Did you hear
aye.
me?
Commissioner Ashcraft.
Yes.
Commissioner Allen Brand.
Alan Brand, aye.
And Chairman Eilert.
Eilert, aye. If I have the correct vote, I have 6 in favor, 1 opposed. Is that correct?
That is correct.
All right, the motion carried. Okay, we've got one other item on the action agenda. Let's attend to that one, and then I'll come back to the question that was asked. Clerk will read the next item.
1 second, please.
Technical difficulties. Technical difficulties.
Item number 5, resolution number 005-22, approve and adopt resolution number 005-22, authorizing the sale of $281,660,000 principal amount of general obligation internal improvement bonds, Series 2022A, WIFIA, the Series 2022A bonds of Johnson County, Kansas.
Okay. Ms. Friedel, are you available?
Yes, this is Leslie Friedel from Budget and Financial Planning. Can you hear me?
Yes.
Yes,
Okay.
go right ahead.
So this resolution is just to set forth the sale of the $281,660,000 principal amount of what is general obligation bond for the WIFIA project. The amount did change from last week by $400,000 for cost of issuance. However, it's still within the total budget of $574 million that was approved on the prior item. As Susan has already discussed with the board, this will we'll continue work on this, work to finalize agreement with the EPA by March 1st, and then we'll be back before you hopefully in April to finalize this item. I would also point out that similar to all other wastewater bonds, this will be paid for from capital finance charges out of the wastewater fund and not tax dollars.
Okay, questions of Ms. Friedel? All right, is there anyone who wishes to speak to this item?
Chair, we have Commissioner O'Hara has her hand up.
All right, Commissioner O'Hara.
Yes, thank you. Because we do not have the audit, because we do not have the requirement of a financial audit connected to this project, my vote will be reflecting that.
Okay, thank you. All right, if there are no other questions, no one else to speak, a motion to approve would be in order. Ms. Hanslick.
Thank you, Mr. Chair. I move to approve and adopt resolution number 005-22, authorizing the sale of $281,660,000 principal amount of general obligation internal improvement bonds, Series 2022A WIFIA of Johnson County, Kansas.
Myers, second.
Hanslick made the motion. Myers seconded the motion to approve the resolution and go forward with the WIFIA financing and the bonds issuance. Any other questions or comments? All right, clerk, please call the roll.
Commissioner Fast.
Aye.
Commissioner Myers.
Myers, aye.
Commissioner O'Hara.
No.
Commissioner Hanslick.
Hanslick, aye.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, aye.
And Chairman Eilert.
Eilert, aye. I have 6 votes in favor, 1 opposed. Motion carried. Are there any other items on the action agenda?
No, sir.
Okay. I'll go back to the question that was raised, and let me start by identifying the relationship between the county and the district court. The district courts are under the supervision of the state court system. The county does provide some funding for personnel that assists the district court. We also provide a supplement to the magistrate judge's salaries. We are required to provide a place for the district court to carry on its business. The question that's before us does not include or does not impact or affect the county's general fund. And it does not impact property taxes that have been collected or sales taxes that have been collected. The court does have its own revenue sources. And the state court system has engaged investigation. And so that's the issue that's before us. Not before us, but before the court system. And when the state court system has concluded their investigation, then we will know all the answers to that. But again, the question is not about county general funds or operating funds or property tax we collect or sales tax we collect. It does involve additional revenue that comes in and is collected directly by the courts. So I hope that answers the question, and that's about as far as I can go. We'll move to reports and communications.
Chairman, I do have one question.
Yes.
Do we do audits, performance audits on the law library?
I'm sorry, audits on the what?
On the law library in the courthouse?
Yes, we do. Yes, we
Okay.
do. Yeah.
Thank you.
And those have been reported in the past, recent past, as I recall. Yes. All right. Reports and communications, County Manager.
Good morning, Commissioners. The first item, the City of Olathe conducted a public hearing on Tuesday, February 15th. The purpose of the public hearing was to consider the issuance of $4 million in industrial revenue bonds and a 50% 10-year property tax abatement. The project is 12,525 square feet industrial facility located at approximately the northwest corner of Dennis Avenue and Pine Street in Olathe, Kansas. The project applicant is Carrier Services Plus LLC. The notice of public hearing and cost benefit report that shows cost benefit ratio is 7.33 for Johnson County was attached to the manager's memo. And I'll pause and see if there's questions before I go to the next few items.
Okay, go right ahead.
Okay.
Chairman?
Excuse me, question?
Yes, very quick. Really more of a comment. I just want to point out that this is a 50% property tax abatement, and that I want to commend Olathe that they have not entered into the bidding war of tax incentives that in some cases are up to 85 to 90%. So even though I wish that we could be rid of all of the tax incentives and look at our overall tax policy, I just want to thank Olathe for at least putting a reasonable limit on it.
Okay, thank you. Next.
Okay, the next item is highlighting Black History Month. February is dedicated as Black History Month, honoring the triumphs and struggles of African Americans throughout U.S. history. And attached are several departments that have that are highlighting this history. And I will move on to the next item. The Mental Health Reentry Project. This month, the Johnson County Mental Health Center is kicking off a reentry project with partnerships from the Johnson County Sheriff's Office and the Johnson County Department of Corrections. This is another effort within the Stepping Up initiative to reduce the number of individuals with mental illness within our jails. A 3-year grant with the Substance Abuse and Mental Health Services Administration has helped make this project possible. A brochure is attached with more information, and also Tim DeWeese is on the line if you have any questions. So I'll pause and see if there's any more that you'd like me to add to this, or I'll go on to the other 2 items.
Okay. Questions or comments? Yes, go ahead.
Okay, Charter Commission update. They did complete their work this week. They are presenting next week on February 24th to the Board of County Commissioners, to you all during reports. And they do have a report with 2 minority reports, and that will be coming forward soon. So the next item is the 2022 release of real estate appraised values. The Johnson County Appraiser's Office is required to mail 2022 notice of appraised values for all real estate parcels in Johnson County on or before March 1st per state statute. Commercial real estate notice of appraised values were mailed this week, and the appeal deadline is Wednesday, March 16th. Residential real estate notice of appraised values will be mailed by Monday, February 28th, with an appeal deadline of Wednesday, March 30th. The Johnson County Appraiser will be here next week to present his report on the 24th. And with that, Chairman, I'll stand for questions.
Okay, any questions? Commissioner,
I have a question.
Commissioner O'Hara or Commissioner Fast?
Yes.
Go right ahead.
All right, I have had communications with our appraiser and on residential real estate, homes, not apartments, that the average increase is 11.96%, which is going to have a tremendous impact on property taxes unless we make sure that we roll our mill levy back so that we do not gain any windfall from this. And again, we are holding a board retreat for our first budget study, and I just would implore the commission to rethink this and to do this as a committee of the whole so that the public can have access via remote. I know that they are permitted to come in person, but that puts a huge burden on many, many people.
All right, thank you. Again, those issues will be discussed as we go through the budget, and I would remind all of us that the budget's consideration schedule has been, I think, outlined, and we have something like 12 meetings that will be as a committee of the whole meeting or as a public hearing or an action agenda item. So there will be many, many opportunities for citizens to follow online or observe in person. So thank you. Anything else, County Manager?
Commissioner Fast has a question.
Okay, excuse me, Commissioner Fast?
Yes, thank you. I would just like to ask about the community reentry program. It sounds like it's focused on individuals in our jail. What about our adult residential center? And, you know, we now started the program a year ago for those at the municipal level, which is just a really great program to provide work skills, supports. I didn't know if Tim could talk about, is this free entry for the adult residential center and municipal level crimes, or just for the jail?
County Manager or Mr. Thompson, can you make a comment?
First, I'd ask. Tim DeWeese.
Yes.
Tim DeWeese is here, and I think she was requesting. Right. I think he's probably about to speak to it.
So Tim DeWeese, Mental Health Center, thanks for the question, Commissioner Fast. It's actually both, so that's why we partnered both with the Sheriff's Department for the work at the jail as well as the Adult Residential Center. That's the partnership with Community Corrections out at the Adult Residential Center. So it is both, and it's focused specifically, as the County Manager said, on those individuals that have major mental illness.
Other question, Commissioner Fast? Okay, thank you. Commissioner O'Hara, you have a question?
Right. I would like to make a motion that the Board of County Commissioners, that we convene as a committee of the whole for all discussions to review the county's budget for 2023, including any budget retreats.
I've already communicated with you by email in regards to your question that the budget retreat, which I think is scheduled for March 31, the afternoon thereof, is in the form of a study session. And anyone is welcome to observe that session, but it will not be as a committee of the whole.
Well, I'm making a motion to the board to make it a committee of the whole for transparency's sake.
Okay.
And I'll second that.
Motion has been made and seconded that the budget retreat be done as a committee of the whole. I would simply say this, it's an opportunity for informal discussions with the staff, and it's a good way to gather information and to understand various aspects of the budget. So I think we should continue as a study session. Ms. Hanslick?
Yes, thank you, Mr. Chair. I agree with you. I don't think it's a matter of transparency. It's a matter of allowing the board to have those conversations. There are, as you mentioned, many, many opportunities for the public to have input. We will have a public hearing, and all of that information is available to the public.
Okay. Any other comments? Ms. Allenbrand?
Mr. Chair, I cannot be supportive of this. It is public, so there is transparency, but I need to have time to review and be able to talk to my constituents about what's in the budget. So to me, this is a good study session for us to learn and ask questions.
Okay. Before we vote, Commissioner O'Hara, you have another comment?
Yes. When we are discussing any business of the county, it should be as accessible as possible to the public. There should be no barriers, and this is a very easy ask that we simply hold this in the boardroom so that it can be broadcast to the public so that they can have the opportunity to hear directly what is happening. I just, it's beyond me as to why we would want to be hiding from the public. That's my comment. Thank you.
Okay. Well, thank you very much. The public is welcome to attend and observe, and we would welcome them to that study session, as always. Commissioner Ashcraft?
Thank you, Mr. Chairman. Mr. Chairman, I've raised this issue before on the budget, on other items. It is open to the public, but the accessibility and the appearance is what has wrangled a lot of people, including myself. So that's why I seconded the motion and will support it.
Any other comments? All right, the motion is before us. Clerk, please call the roll.
Commissioner Fast.
I apologize. Can you say the motion again?
The motion is to conduct the budget retreat as a committee of the whole meeting rather than a study session, informal study session. So a yes vote would require this to be a committee of the whole.
Correct.
Commissioner Fast.
Yeah, I don't have a strong opinion.
Okay, there's one abstention. All right, next.
Chair, could I ask for a legal opinion on that?
Mr. Chairman, at this point, she cannot abstain because it's
I'll say no.
just pass, and then you can go back to her if you.
Okay.
Yeah, just
Well,
pass. I just
yeah,
time.
Commissioner, we will pass and come back to you. Okay?
Commissioner Myers.
I'm sorry. My vote is no. Again, I think the process that we've been talking about is commonplace. It's something that happens at every level of government that I've ever been involved with. So I think it is very open. Again, public can come. So my vote is no.
We have one no vote.
Commissioner O'Hara.
Yes, transparency is
Commit-
paramount importance.
Thank you.
Commissioner Hanslick.
Hanslick, excuse me, Hanslick, no.
Commissioner Ashcraft.
Yes.
Commissioner Allenbrand.
Allenbrand, no.
And Chairman Eilert.
Eilert, no.
And Commissioner Fast.
Yes.
All right. I have 3 votes in favor of the motion and 4 votes opposed. The motion did not carry. All right. Are there any other reports?
I believe we're ready for the.
I'm done with my report, Chairman.
I'm sorry?
I'm done with my report, Chairman.
Who is that?
That's Penny.
Chair, we now have other reports of legislative update.
Okay. Mr. Thompson, anything in that regard?
Yes, very, very briefly this morning, a couple items of note. Chairman, you've got your report. The only thing I would call to your attention can be found on page 2 of it. Several tax bills regarding food sales tax. As we know, that's one of the primary topics of this session. A bit of action on a number of bills that you'll see on that report. All of those measures, and again, there are 4 separate tax bills relating to the food sales tax reduction, have now been amended into one new base bill. That's Senate Bill 339 for folks who are following that activity. That is set to become effective on January 1 of 2024. Secondly, I know there's been a number of commissioners interested in House Bill 2543, which was a proposal from Representative Joella Hoy regarding early onset Alzheimer's and its relationship to the Area Agency on Aging. I believe a number of you know, but for the public's benefit, that issue appears dead for this session. I've been in contact with Representative Hoy, still has an interest in that, but we'll be talking about that next session. But again, emphasize that issue is dead for this session. Next, I would turn to House Bill 2619. There was a hearing for that yesterday. This is a bill that I believe I brought to the board's attention last week, requiring that total compensation of elected county and city officers be posted on such counties or cities' website. Again, a hearing was held on that bill yesterday. And then finally, I mentioned last week that we're into budget hearings at this point. I would note that the House Transportation and Public Safety Budget Committee has approved the governor's recommendation for additional funds for community corrections, which of course would have a positive impact on Johnson County. So at this point, funding for community corrections is recommended by both the House and Senate subcommittees consistent with the governor's recommendation. So making good progress here. The full House and Senate budget committees then will consider the final budget within a couple of weeks, so we'll see how that progresses. And with that, be happy to stand for questions.
Okay. Commissioner O'Hara, you have a question?
Yes, on the House Bill 2543, the issue was that it would be diverting money from the Department of Aging. Is that correct?
Thank you for the question, Commissioner. That was the fear. Actually, the state had prepared a fiscal note requesting the additional funding to do that. As we all know, that can work out, that the legislation could be approved without that additional funding. So that was the risk or the threat identified by the area agency.
Okay, and then do you have an update on Senate Bill 338?
I do. In anticipation of that question, I looked this morning.
I'm consistent.
Yes, you are. It is still sitting in Senate Local Government Committee. There has been no action on it.
Okay, and that bill, just to let people know, that is concerning Kansas City Area Transit Authority, and that would disallow them using property tax exemptions for high-rise apartment projects for up to 30 years, and also that those projects would not pay sales tax on any construction materials, fixtures, or equipment, and that the KCATA also has eminent domain power that they could take property from private citizens and transfer it to private developers. So that's what that's about. Thank you.
Okay. Any other questions, Mr. Ashcraft?
Thank you, Mr. Chairman. I wanted to thank Mr. Thompson for the update on House Bill 2543. I had reported that it was dead once before, but when it's in the legislative process, things miraculously reappear. I received the same report. Fortunately, Pam Chernock, who's chairing the Aging Commission, is very sensitive to this, and I've talked to her repeatedly, and I think it may really be dead this time. However, I wanted to point out one suggestion that was floated out there was, rather than having this legislative initiative become an overwhelming program for the Senior Care Act, that there might be opportunity to develop a pilot to see if there is a cost-beneficial impact for recipients of those services. That would make sense, and I think that would be a good way to test it out rather than trying to spring it on a program that does so much for residents, keeping them at home. So I appreciate you staying on top of that, Mr. Thompson.
All right. Any other questions, comments? Okay. Mr. Thompson, thank you very much. We will turn to commission comments. Ms. Allenbrand.
Thank you, Mr. Chair. I've got several things to report. First of all, New Century Airport. We had just had a facelift on the west ramp in connection with FAA, and we're hoping to work on some more grants for that, but that should help us get ready for the U.S. Air, the Thunderbirds coming here over Labor Day weekend. I also went out to the new station, Fire Station 5, that's out in Edgerton, and did a tour through there and met with some of the firefighters, and I just thank them for everything that they're doing, and it's a great looking fire station. If you haven't been there, you should go out and see it, but they are going to have an open house sometime around the end of April. Also, there was a restaurant, not restaurant, but a food market that opened up called New Hope. in Gardner, and it's to help people that need groceries. And so that just opened up in a new location. And then yesterday, we had a great meeting, and I thank Brian Pegg and his staff for continued work through working with the mayor of Edgerton and Gardner. We had meetings yesterday, and with all the other staff in the 6th district on just how to address our truck routes and up-and-coming road needs.
Okay, Mr. Ashcraft.
Thank you, Mr. Chairman. Mr. Chairman, I just wanted to comment on Commissioner O'Hara's impromptu motion earlier about the child care issue, or child care providers and the interactions with the Department of Health. Did I understand you correctly that we would have some discussion on that next week?
Yes.
Okay, thank you.
Under reports and communications.
All right, thank you.
Commissioner Hanslick.
Thank you, Mr. Chair. Couple of updates. As the Commission's liaison to the Johnson County Library Board, I wanted to let you know at our meeting last week, we were discussing some of the upcoming capital projects. First of all, the renovation of the Central Resource Library is just about complete, and we will be having a reopening ceremony next Tuesday, February 22nd at 2 p.m. That will be broadcast on the Johnson County Library's Facebook page, so my understanding is they're trying to limit the in-person crowd for that. Secondly, the Antioch Library is in design development, and the bidding and construction phase will start later this year, in the fourth quarter of this year, with completion in hopefully in early 2024. So we'll have more news as that continues. And then also, something I'm very excited about and interested in is that the library is undertaking what they're calling a renewal study for some of our more rural library locations in DeSoto, Spring Hill, and Edgerton. And as part of that, there will be a virtual community engagement opportunity on March the 3rd at 5:30 p.m. And I'd encourage people who are interested in participating to go to the library website for more information. And then finally, following up on our recognition of Black History Month, I did want to point out that the Johnson County Museum at the Johnson County Arts and Heritage Center just recently opened a special exhibit called Redlined. And what that does is it refers to the practice of designating areas basically for racial discrimination, to deny services, usually financial, to residents of certain areas based on their race or ethnicity. And the exhibit explores how that has impacted Johnson County. So I'd encourage people to visit that, and especially during Black History Month. And that's all. Thank you.
Mr. Myers.
Thank you, Chair. I never want to leave out our county staff and our employees for the wonderful work that they've done during this pandemic. I don't think they can be thanked enough times for all the work that they do. Also, our residents. You know, our residents really have done a wonderful job during this pandemic, and hopefully we're moving into an endemic stage soon. I think now is a great time for reflection. I believe reflection is the most important part of problem solving. Taking a look at what we have done good, what needs to be changed, how can we do things better. It's something that we as Board of County Commissioners do constantly, and I know our staff does also, constantly reflecting on how we can do things better. I attended yesterday the 5th out of 6 4.5-hour sessions with the Racial Equity and Communities Workshop. Again, extremely interesting, went well. I also attended the Johnson County Parks and Recreation District meeting last night. We are also moving into our budget phase. We had an announcement from Joanne Courtney, who has been an employee for 37 years, and she is our administration manager and is going to retire. So happy retirement to her. Also, lastly, next Wednesday, I will be attending my orientation for the KCATA as liaison for the county, and also attending my first meeting on that day. So busy schedule, but interesting and something that I'm really enjoying doing. Thank you.
Okay, thank you. Commissioner O'Hara.
Thank you, Mr. Chairman. Well, I'm happy that Commissioner Myers could get into the, I'm assuming it was a Zoom meeting yesterday for the racial equity in communities, since in January I was not allowed. But being the mother of my daughter is of African and Korean descent, that I must tell you how vigorously I oppose this CRT. It's destructive. It is not helpful, and we really need to be focusing on judging people by their character, not by the color of their skin. Also, I know that I have been told that as of Monday that we will be relaxing the requirements on our employees, that I understand that a mask will be optional at that point, and I'm thrilled about that. I had some real concerns about discriminatory actions against the vaccinated versus the unvaccinated. And I think that that's all I need to comment on. Thank you.
Well, I think the county manager has an announcement that will come at the appropriate time in regards to our employee base. Commissioner Fast.
Yes, thank you. I just wanted to follow up on Commissioner Hanslick. I went to the Red Line exhibit this past weekend. It's just incredible history. Our Johnson County Museum, I mean, it is just top notch. And we are just so fortunate in the county to have such an incredible museum. So I just really encourage everyone to go to the exhibit. This last week, I spoke at the City of Westwood council meeting, giving them a county update. On Monday, I spoke at the City of Merriam, giving them an update on what we are doing at the county and how we want to work together. Both of these cities are interested as we make more of our plans for the ARPA funds. I also have scheduled a meeting on Friday with Tim DeWeese, Trustee Ingrams, and the president of Johnson County Community College and his deputies to talk about our behavioral health workforce and how can our mental health center work together with JCC on this workforce shortage, which I know our auditor is working hard on interviewing and having listening sessions to identify strategies that will come before our commission. I've talked to Penny and Maury. I still would like to have a workforce study session. I know we have a lot coming up in the next month or two. Can that still be on your list at some point, especially when the audit is complete for mental health? Can we have a workforce study session?
Okay, all right.
Commissioner Bass, this is Penny. One is scheduled for March, next month.
All right.
Oh,
Thank
okay.
you.
Well, boy, that's action.
Okay.
Mr.
Thank you
Chair.
very much. Mr. Myers.
I'm sorry, I don't do this often, but I have a message that I read that I think is appropriate to read to everyone. It's something that I think is very important. The aftershock of the pandemic has left many feeling burned out and pessimistic. But I want to encourage you to feed yourself every day with positivity and optimism so you can feed others. I think it's a great message. I know positive attitude goes a long way to solving an awful lot of issues.
Okay. All right, thank you very much. We do have an agenda review. I'd suggest that we take a 5-minute break, come back and complete the agenda review. There are several planning items, so it should not take a real long time. So we are.
Chairman, there's just one thing I wanted to let you guys know. I'm a little concerned because the weather continues to be pretty bad. And I know that you guys have driven in, and I just want to make sure you guys are safe to get home.
Yeah, thank you very much. Okay, we are adjourned from our regular session, and we'll come back as soon as we can for agenda review. Thank you all very much.